Welcome to this update of HPI's impact of COVID-19 on the dental care sector research program. Today we're going to go over insights from data collected for the week of October 5th. My name is Marko Vujicic, along with Chelsea Fosse. We'll be walking you through our latest data. As we do in these updates, we'll focus on three things. We'll give the latest core data that we've been tracking, so we'll update the latest data from our poll. This week we have questions of the week that focus specifically on recruitment and hiring in dental offices, some really interesting results. And as usual, we'll also give the latest updates on consumer sentiment data as they relate to visiting the dentist. Hopefully you're all familiar with this. This is a bi-weekly tracking poll. All the information is at ada.org/HPI. With that, I'm going to turn it over to Chelsea to walk us through the latest findings. Chelsea.
Thank you, Marko. All right, so let's get started here with some of our core questions. We've been asking our panel, what is the current status of your dental practice? The very bottom row shows responses for the week of October 5th, our most recent polling data. Green indicates open and business as usual. Yellow is open but seeing lower patient volumes. Orange, which is barely recognizable anymore, indicates closed but seeing emergencies, and the red is outright closed. Adding that green and yellow, we see that 99% of practices in the US were open as of the week of October 5th. Just under half of those practices are reporting business as usual in terms of patient volume, which represents a slight decline over the past month. Next, we asked, how does this week compare to what is typical in your practice in terms of total patient volume? We've recently changed our categorization of patient volume as we try to get more granular information on the majority of practices that are reporting patient volumes at 76% or greater of what was typical pre-COVID. So please note that the changes in the scale and color scheme for our most recent two waves, the weeks of September 21st and October 5th at the very bottom. When weighting these, we see that patient volume in dental practices is at 80% of pre-COVID levels as of the week of October 5th. Looking upward a few polling waves, you can see that there has not been much change in this recently, so patient volume is leveled off. Here we've asked, is your dental practice paying staff this week? Green indicates yes fully, yellow is partially paying staff, and red is not paying any staff. Staffing in dental practices was at roughly 93% of pre-COVID levels as of the week of October 5th. This has been stable the past several weeks. There are some questions we have specific to non-owner or employee associate dentists. We've been asking, of these non-owner dentists, are you being paid this week? Same color scheme as before, where green is yes, being paid fully, yellow is partially being paid, and red is not being paid at all. Roughly 20% of employee dentists were being paid partially or not at all as of the week of October 5th. So employee dentists have seen the biggest lingering employment effect. Among those who were not being paid at all, we asked, are you currently receiving unemployment benefits? Green is yes, so for those who are not being paid at all, less than 30% were receiving unemployment benefits. We've also been asking about PPE supply. How many days worth of the following PPE does your practice have at this time? Moving from right to left in these bars, green is more than 2 weeks supply. Yellow is 8 to 14 days supply. Orange is up to a week, and red is 0 days of supply. We've been tracking N95s, surgical masks, face shields, gowns, disinfecting supplies, and recently added gloves. Gowns and N95s remain the biggest issue, as well as disinfecting supplies and now gloves. Comparing this to past waves of data, PPE availability in dental practices has been stable for several months. All right, so now we'll get into a couple of our questions of the week. We asked owner dentists, have you recently or are you currently recruiting any of the following positions in your practice? The dental team positions of interest listed on the left are hygienists, assistants, dentists, and administrative staff. Green indicates yes, recently recruited or currently recruiting, and red is no. Roughly 1/3 of owner dentists have recently or are currently recruiting dental assistants, and about 1/4 are recruiting hygienists. About 20% are recruiting administrative staff, and less than 10% are recruiting dentists. There is some variation in the responses based on DSO affiliation and size of practice. Here we're showing the breakdown of that same question. Have you recently or are you currently recruiting any of the following positions based on affiliation with a DSO? The DSO affiliated dentist respondents are shown in the graph at the top. And on the bottom, we have those who are not affiliated with a DSO. As you can see, DSO locations are recruiting more heavily across the board, especially for assistants and dentists. There's a similar trend for practice size, where large groups are recruiting more than solo or small group practices. That information is available in the full report online. For any dentist who reported they recently recruited or are currently recruiting for any position, we asked this: compared to before the COVID-19 pandemic, how challenging was it to recruit the following positions? Going from left to right, we start with extremely, very, and moderately challenging in those darker shades of teal. Then moving further right, we get to the lighter shades representing only slightly challenging or not challenging at all. Starting at the top, we see that nearly 80% reported it was extremely or very challenging to recruit hygienists, and roughly 70% said the same for assistants. The majority of those recruiting administrative personnel also reported that it's been extremely or very challenging. Recruiting dental team members has been much more challenging for owner dentists compared to before the COVID-19 pandemic. All right, now we will shift gears again and take a look at some of our household data. We've been partnering with Engageus, a leading consumer research firm, to explore consumer sentiment toward visiting the dentist during the pandemic. Engageus has been asking this question specifically of dental utilizers, folks who reported that they had a dental visit in 2019. So these are people who we commonly pre-pandemic would see in our dental chairs. Which of the following represents your current point of view regarding visiting a dental office? 24% in the dark green at the top left, roughly 1/4, are those who have already been back to the dentist. On the right, we see 55% who say that they're ready to go back. That yellow piece of the pie on the left represents assurance seekers, folks who need a little extra comfort, communication, assuredness that returning to the dentist is safe. And lastly, in red, we have the folks who report they'll need a medical breakthrough, a proven vaccine or COVID treatment or therapy before heading back to the dental office. So what does this tell us? If we take all the slices of this pie, except for those who need a medical breakthrough, we get to about 85–86% of patients who have, will, or may return to the dental office in the foreseeable future. That's our upper bound of what we can expect to see in terms of patient return, about 85–86%. As you might recall from prior slides, we're currently seeing patient volumes leveling off right around 80–81%. So we're getting close to that upper bound without any major developments in treatment or vaccination. Engageus also included some questions on the topic of vaccination in dental offices in their household polling. The first on the left is, if you were already scheduled for a routine dental visit, would you be willing to get an annual flu shot while at the dentist office? The majority, 61%, report yes, they would be willing to get a flu shot at the dentist office during their routine visit. On the right, we have imagine a COVID-19 vaccine is currently available. If you were already scheduled for a routine dental visit, would you be willing to get a COVID-19 vaccine while at the dentist office? Again, the majority, 59%, report they would be willing to get a COVID-19 vaccine at a dental office as part of their routine dental visit if available. So the key takeaways from this week, our polling data from the week of October 5th. Recovery, we're seeing that about 99% of dental offices are open and patient volume is at about 80% of pre-COVID levels. Staffing's at 93% of pre-COVID levels, and most of this is largely unchanged for the past several weeks and in some cases months. Dentists are hiring. Roughly 1/3 of dental practices are recruiting dental assistants and 1/4 are recruiting hygienists. DSO-affiliated practices in large groups are recruiting more heavily than non-DSO and solo practices. But recruitment is a challenge. Recruiting dental team members has been a challenge, especially in terms of hygiene and assisting, where 80% are reporting that it's extremely or very challenging for hygienists and 70% say the same for assistants. Patients are reporting that they'd be willing to get vaccinated at a dental office if given the opportunity. They're open to the idea of vaccination as a part of their routine visit, whether it be for a flu shot or for a future COVID-19 vaccine. As always, the full report of polling data is available online at ada.org/HPI. You can find past webinar recordings, reports, and listed questions of the week on our COVID impact polling webpage. On behalf of the entire team at the ADA Health Policy Institute, thanks so much for tuning in today, and please take care.